tracking system. And of those 39 incidents, 27 were found to be violations of our privacy and security operating procedures. 9 were found not to be violations. 3 are still under investigation. Of the 27 that were violations, 6 were determined to be breaches, and they involved breaches, incidents where our medical record retriever sent the patient records to the wrong recipient. One incident where a patient grabbed discharge papers of other patients before leaving the facility. One case where a letter containing PHI was mailed to another patient's employer, and an incident where a detailed bill of one patient was sent to a different patient. In paragraph 10, talking about the Office for Civil Rights report, we received 3 in the last reporting period. One in July about Elmhurst, alleging that Elmhurst didn't provide the patient with a copy of his medical records. The OCC conducted an investigation and discovered that the dates of service for which the records were requested were back in 1982. Elmhurst had responded to each request by indicating that those records had been destroyed in accordance with our record retention policy. In August, the OCC responded to the OCR explaining the results of its investigation. Also in July, the OCC received a letter regarding a complaint by a record retrieval company that alleging that Lincoln failed to provide a patient with access to the medical record. Although the OCR stated that it was closing the case, we did investigate the matter to determine the root cause. We determined that the complainant was not the patient's personal representative and therefore was not allowed to request the medical records on the patient's behalf, and the request was processed as a third-party request. Finally, in August, we received a letter from the OCR regarding complaints alleging that Elmhurst might not be in compliance with the HIPAA privacy rule. We are preparing a response to this letter as of now. On page 4, we have the summary of the reports, compliance reports. There were 122 compliance reports. None of them were classified as priority A, 28 were priority B, and 94 were priority C reports. Moving on to page 9, paragraph 17, regarding, this is an update on the status of One City Health. As previously reported, an independent assessor had conducted a year 4 on-site audit of One City Health to determine whether it correctly received district funds. They issued a preliminary scorecard in early March, which requested additional documentation to support patient engagement activities and justification for the workforce spend. The One City Health submitted its response in May, and based on the final payment scorecard that it received from the New York State Department of Health in September, there were no significant findings. In addition, One City Health had exceeded its projections by hitting several high performance metrics. The state announced that there will be no year 5 on-site audit by the independent assessor. Moving on to paragraph 18, the One City Health Partner Compliance Attestation. One City Health distributes a memorandum attaching an attestation to all of its partners, requesting that they are complying with the training obligations and other compliance obligations. It was sent out to all 156 partners, and 112 attestations have so far been received. Moving on to the ACO Inc., HHC ACO Inc. update. In June, Dr. David Stevens was appointed as the Chief Medical Officer of HHC ACO. And also in June, the Board of Directors of Health and Hospitals passed a resolution designating Matthew Siegler to serve on the Board of Directors of the HHC ACO. In September, CMS released the 2019 performance year results for the Medicare Shared Savings Program. And according to those results, the HHC ACO earned a performance payment of over $4,600 compared to, $4,623,337 compared to nearly $3 million in performance year of 2018. and they exceeded their quality score from 2018 as 92.7 compared to 83.39. And they're currently working with the Comptroller's Office for Health and Hospitals to finalize their final financial audit. Moving on to paragraph 22 with regard to our risk analysis and security assessment. Health and Hospitals has engaged a third-party vendor, Coalfire, to conduct its enterprise-wide risk analysis and security assessment. They did on-site reviews in 2019, as well as some virtual reviews of Gotham clinics. And they also did penetration tests to determine our vulnerability and unauthorized access of our systems applications. At the end of 2019, they issued a risk management plan that identified high and very high security risks to health and hospitals based on its risk analysis. That was shared with senior leadership to determine what treatment to be given, accept, mitigate, transfer, or share. The risks to be mitigated are assigned to appropriate individuals for the mitigation plans, which are being tracked. Coalfire is currently wrapping up its year 2 and risk analysis engagement, and it's reviewing the status of remediation plans and initial reviews of some clinics and the skilled nursing facilities, and we'll have final reports at the end of this year. Page 12, paragraph 26, the Deficit Reduction Act requires health and hospitals to have written policies and procedures that inform its workforce members about our policies covering fraud, waste, and abuse and False Claims Act, whistleblower protections. In order to comply with this, the Office of Corporate Compliance distributed our operating procedure 50-2, policy on fraud, waste, and abuse and false claims, and it also contains a review of the relevant laws. Paragraph 26, our draft risk assessment is required as part of the compliance program that health and hospitals have a risk assessment periodically. The Office of Corporate Compliance developed the draft risk assessment for fiscal year 2021, which was derived from risk identified by the OMIG and by OIG work plans, and some that were initially identified internally. As part of this risk assessment process, the compliance officers within the Office of Corporate Compliance met with the compliance committees at the facilities to review the draft risk assessment and ask them what risks are of greatest concern to them. Finally, on September 10th, 2020, the Chief Corporate Compliance Officer presented the draft risk assessment to the Executive Compliance Work Group to get his input. The Executive Compliance Work Group determined which risks in the draft risk assessment should be included in the fiscal year 2021 Corporate Compliance Work Plan, which will be presented to the Audit Committee for review and approval later this year. That concludes my report.
Thank you, Catherine. Do any of my fellow committee members have any question on the report?
Helen, Jose Pagan here. Just want to commend the system for thinking about the HIPAA risk analysis and how that has been conducted from 2019 and 2020. And I look forward to learning more about the process and recommendations and so on that. So thank you.
Thank you, Dr. Pagan. Anyone else?
No.
Okay, then next we'll have an audit update from Chris Delano. Chris?
Thank you. This is Chris Delano, the Chief Internal Auditor of New York City Health and Hospitals. I'll start my briefing on page 3, which summarizes the audits being done by external regulatory agencies. On page 3, it's an audit of the oversight of auxiliaries being done by the New York City Comptroller's Office. They stated that the purpose of the audit was to determine whether health and hospitals implemented sufficient control procedures to effectively monitor the performance and fiscal activities of its auxiliaries. The scope of the audit is January 1st, 2018 to the present. The audit began with a meeting that was held on June 23rd, 2020 with the Senior Vice President of External and Regulatory Affairs, to discuss her department's involvement with the auxiliaries. Numerous documents were then requested by the Controller's Office. More recently, the Controller's Office met with representatives from the auxiliaries and facilities from New York City Health and Hospitals, Woodhull, Metropolitan, and Queens to understand the day-to-day interaction between the hospitals and auxiliaries. This audit is ongoing. The committee should also be advised that the Inspector General from New York City Health and Hospitals is conducting an investigation of the auxiliaries. And I only know this because the CFO from East New York was contacted by the IG's office. They were requesting the tax returns from the East New York auxiliary, and he just wanted to ensure that he could do that. Also, they have contacted me to obtain the name of the new CPA firm that was hired earlier this year to conduct the auxiliary audits. Moving on to page 4, this audit is also done by the New York City Controller's Office. The purpose of this audit was to review Health and Hospitals' controls over nursing homes, compliance with rules and guidelines. The scope of the audit is June 2017 to the present. The entrance conference was held on August 19th with the Senior Vice President of Post-Acute Care, the Senior Vice President of External and Regulatory Affairs, and the General Counsel, and the Post-Acute Care Chief Medical Officer and the internal audit staff. Various documents were then requested during the meeting. On September 17th, the auditors held an individual meeting with the Senior Vice President of Post-Acute Care for the purpose of learning about the process and controls set up by a nursing home, as well as methods used to oversee and carry out those controls on a day-to-day basis. This audit is ongoing. Moving to page 5, under the heading of other audit activities, during the course of the year, internal audits received 4 letters from the President's office with negative allegations regarding various functions within the system. After some research and inquiry, 2 letters were deferred to other departments for review. I will discuss the 2 letters in which we investigated. The first one was of hospital police at New York City Health and Hospital, Harlem. The primary allegation in this letter was about the personal usage of a system-owned vehicle by hospital police. Overall, we concluded that all of the allegations in the letter could not be substantiated. We did recommend, however, that a mileage log be used by hospital police for the vehicle used exclusively by them. The CEO of Harlem Hospital advised us that the mileage log is in place for the vehicle and that it is used now by both transport and hospital police. The second letter we reviewed was of the Claims Department of Metro Plus, and there were numerous allegations asserted in this letter. About half of them were investigated by internal audits. Most of the accusations involved critical timesheet recording errors and favoritism by management within the Claims Department. We concluded that 10 of the 13 accusations that we reviewed could not be substantiated. The review of the other 3 allegations revealed timesheet versus swipe report discrepancies in 2 instances. Subsequent to our investigation, Metro Plus management provided us with a report that gave explanations for the discrepancies of 1 employee. Although the report did not account for the discrepancies for the second employee, more recent research done by the Metro Plus Human Resources Department revealed that they were a result of recording errors. Hence, no action needed to be done per the CEO from Metro Plus. The other issue was regarding implied favoritism and bad optics in one case. Upon becoming the interim director of claims in November 2019, 2 direct reports were promoted in December. Although both employees may be deserving of the promotion, this action gave the appearance that favoritism may have existed, as all 3 employees worked at Emblem Health during the same period of time and knew each other. The CEO believed that no action was needed, as both individuals were qualified for the promotions. Unless there's any questions, that concludes my presentation.
And just for the committee members, if anyone has a question, Ebony is on the line, correct? If they have any questions for her. The CEO of Harlem.
Ebony is on the line, and Dr. Schwartz from Metro Plus is also on the line.
And
Is
Dr.
also in the meeting.
So do any of my fellow committee members have any questions?
No.
Okay. I just have a comment, Chris. I just want to thank you and your team for helping out the auxiliary, not organization, but I guess the team, auxiliary teams, because, you know, these are volunteers positions and these are individuals that have retired and trying to do all this extra work when you're getting audited for things that you have passion for.
Yes.
And it's a volunteer basis. So I just want to thank you for that, because that probably comes down a lot of anxiety. I just want to thank you.
They were very concerned, right? We interacted with the auxiliary members, the presidents of the 3 sites that they visited or they had meetings with. And they were very concerned because this had never occurred in the past for them. And we did kind of try to prep them before and after, but it may not have always worked.
Well, thank you for the support, because I appreciate that.
Thank you. Thank you for the comments.
Alrighty, so next on our agenda, we'll have a presentation. Sorry, I just lost myself. Next, we'll have a presentation on our fiscal year 2020 draft financial statement. Related notes by our CFO, John and Jay.
John, I'll take this. Good morning, everybody. This is Jay Wyman, Corporate Controller. The 2020 audit is near completion, essentially complete, by our auditors Grant Thornton. They are presented as draft financial statements because the audit goes on until the actual sign-off, which doesn't happen until after this committee meeting. There may be some minor changes in grammatical sections, or some of the numbers may immaterially change. We don't really expect any changes, but if they do, they should be immaterial. If it is material, we will notify the board before they are finalized. The statements are consolidated with Metro Plus. They are listed as a discrete unit, separate column within the financial statement numbers. For purposes of our discussion today, we will concentrate on the business type entity, which is the remaining of health and hospitals. Overall, operating income was improved this year to $48.5 million positive compared to last year at $90 million negative. A lot of this has to do with COVID activities, both in revenues and expenses. And when I turn this over to James Linhart, he'll explain some of the variances. Overall, we had $666 million in the bank at the end of the year, which is about 28 days of cash, and our financial ratios are relatively healthy, consistent to prior years. And I will turn it over now to James Linhart, Deputy Corporate Controller, to go over the details of some of the variances, unless there's other questions. All right, thanks.
Good morning, everybody. So on screen is the P&L for 2020, and the next slide is 2019. If you have the package that was distributed early this week, I'm referring to pages 45 and 46 of the package. So overall, as Jay was saying, the corporation's net deficit position improved by $247 million. The operating revenues, when I'm doing the review, I'm only speaking to the tune of the first column, business type activities for health and hospitals. on both pages, 2020 versus 2019. So the operating revenues increased 1.157 billion from a reported 7.897 billion in FY19 to 9.053 billion in FY20. Line 1 of the operating revenues, net patient service revenue, reported for FY20 6.676 billion versus 6.039 billion for FY19, which is an increase of $638 million. And as Jay had stated earlier, this is mainly due to the increased COVID issues related to increased CMI and increased utilization. Line number 2.
I'm trying to follow you, and our pages are different. Khaleesi, is it possible to
It's Sally, this is Khaleesi.
Yeah,
Go to
yeah.
page 16. We are on page 16. If you look
Okay.
at the bottom of the financials, we're on page 16.
Thank
We're going to
you.
review 16 and 17.
Thank you.
I'll wait a few seconds.
I just want to mention, so page 16 is the current year, page 17 was last year.
Okay, thank you.
So going to line number 2 of the operating revenues, appropriations from the City of New York. It's reported $673 million for FY20 versus a reported figure for prior year of $1.064 billion. And that represents a decrease of $391 million. And it's due to the decrease in cash received from the city for collective bargaining and other subsidies. Moving on to line number 4 of the operating revenues, which is grant revenue. 1.499 billion for FY20 versus $650 million for FY19. This was an increase of $850 million, mainly due to CARES Act pandemic funding of $1 billion and offset by a decrease in DSRIP funds. Line number 5 for operating revenues, which is other revenue, increased $60 million from $144 million in prior year to $204 million in current year, largely due to an increase in 340B pharmaceuticals revenues. Moving on down to operating expenses. Line number 1 of operating expenses is personal services. And we witnessed a $132 million increase, 2.847 billion to 2.980 billion, FY19 to FY20. And this is mainly due to an FTE increases of 2,400 plus employees and increased usage of overtime. Line number 2 for operating expenses other than personal services increased 1.062 billion, and this is primarily related to COVID expenditures. Line number 4 for operating expenses and line number 5 for operating expenses, which is pension and post-employment benefits. Pension decreased $147 million, and post-employment benefits other than pension, or what we call OPEB, decreased $139 million. Both of those calculations are completed by the New York City Office of the Actuary. And line number 7 for operating expenses, depreciation, increased $56 million, due mainly to increase in EPIC issues and related COVID facility purchases. We did put on a new facility this year called REMC, Roosevelt Island Medical Center. And I skipped line number 6, which was affiliation contract and services. My apologies. We reported 1.161 billion in FY19 to a reported 1.232 billion in FY20. That's an increase of $71 million or 6%. And it's due to new programs and COLA increases. Moving on down to the bottom, other changes in net position. It increased 85.1 million. Line number 1 remained relatively constant, which is capital contributions funded by the city. Line number 2, capital contributions funded by grantors and donors, increased $85 million. And that was mainly due to something called Section 428 FEMA mitigation at Coney Island Hospital, which is all related to Hurricane Sandy that happened a couple of years ago. And that concludes my report on the operations. Anybody have any questions?
James, this is Colin. I just have a question. When we're looking at the grants for the coming year, or maybe John, have you guys forecasted or what might look if we get a second wave?
None.
Well, I do want to address these statements because the statements do conclude at June 30th. So there are no projections within these statements.
Okay.
We know, and it's noted within the financial statement notes, that we did get subsequent funding both for FEMA and for the CARES Act. Roughly a little less than $400 million between the two. That is noted at the end of our report in the footnote section, but this is not projecting neither what what has occurred post June 30th. So we know that we have an influx of some patients, and again because we neatly tie the knot at June 30th. There's very little projection that's gone on in here.
Okay, thank you. Do any of my other fellow members have any questions?
No, thanks.
No, thank you.
Jay, do you want to continue? Okay.
I'm sorry. So this is Jay. So we do have a presentation by Grant Thornton, part of their required communications to the committee, and they have a presentation as well.
Hey, good morning. Can everyone hear me? This is Tammy.
Yes.
Okay, perfect. Okay, switch to a headphone because it was a little bit echoey before. So I'm just going to take you through the key pages, and I'll let you know which page I'm on. The page numbers are listed in the bottom of the presentation so that you could follow along. So first of all, I'm Tammy Radinsky. I'm the partner on New York City Health and Hospitals Corporation, the financial statement audit as of June 30th, 2020. And I have key members of my team here today who have been key members since the inception of our relationship. So really nice to see many of you virtually. Hopefully we can meet in person in the near future again. Before I begin, I just want to say thank you to John and Jay and James, Nicole, and the rest of the team and the Metro Plus team really for the support and collaboration during this entire process. I must say from our perspective, this process, the audit process was seamless, even given this remote work environment. So really kudos to the entire team for the efficient process and really working together with my team to get us to where we are today. As James mentioned, we're pretty, and Jay, I would say we're pretty much completed with our audit on slide 14, which you don't have to flip to now. There are a couple of items with our detailed testing that are open. If there's anything significant, we will of course alert the committee, but we don't anticipate anything. But if there is, we'll come back to the committee as appropriate. So that's just, and I'll make note when we get there. Sorry about the flipping around. So now if you turn to slide 3, and we can pass through slide 14 when we get there. If you turn to slide 3, this outlines the responsibilities of both our team, Grant Thornton, your external auditors, management, those charged with governance. So our responsibilities, really just to point out or to express an opinion on the financial statements. And the key thing here is that we plan to issue an unmodified, the cleanest opinion possible. So really, again, kudos to the entire finance team. The responsibilities of management, those charged for governance, are listed out here. I won't go through each of those in detail. Slide 4 talks about the deliverables, and what you can see here is the first one is the financial statements that you have set forth in front of you, and the various other deliverables and financial statements that we issue as part of our audit process, whether it be as of June 30th or December 31st relating to Metro Plus and the insurance company. We'll also come back to you later in the year at a subsequent meeting and talk to you about the management letter. We'll comment on a couple of key items on that later today, but the formal letter is issued in the December time period. If you now go to slide 6, as everyone's well aware, the COVID-19 pandemic has obviously impacted all of us, and there's various audit procedures that we had to focus on this year, different from other years. The one that I'll just bring your attention to, and I'll talk through in a little bit more detail, is really the impact of the various funding. So as Jay and James clearly alluded to, the organization has received a significant amount of CARES Act funding, And as a result, we did, and we focused, and we're actually in the midst of completing that testing on the related funding that was received, as well as various other disclosures and risks and uncertainties that you might see throughout the financial statements as you go through some of the details. On slide 7 is the fraud considerations. We're required here. Obviously, our audit is not here to detect fraud, but if we are made aware of anything, we would let the committee know. So we're just going to pause for a minute. Is any of the committee members, we've already spoke with management, is any of the committee members aware of fraud that you should be alerting us to at this moment in time?
No.
No. Okay, great.
No.
Okay, so now if you turn to slide 9, as part of our audit testing, our technology team, our specialists in this area spend some time looking at the various systems within your organization. So I'm going to turn it over to Sandy for a brief moment just to talk through some of the testing that we perform as part of our audit process.
Thank you, Tammy, and good morning, everyone. I am Sandy Popla, and I'll be providing the IT audit update. Before I get into the results, I'll quickly reiterate the scope. So in support of the financial statement audit, we review the system and automated controls in place, which help support, maintain, and generate the financials. Consistent with our scope of our IT general controls review from last year, we performed a design review for our 4 in-scope applications, Unity, Sorian, PeopleSoft, as well as Epic. Essentially, we looked at 3 main control sets, first being logical security, for which we reviewed related policies, user access reviews, provisioning user access rights, and IT segregation of duties. Second being change management, for which we ensure that any and all changes are conducted in accordance with management's expectations. And third, operations, for which we review data redundancy, backups, monitoring, systemic interfaces, cybersecurity, and the like. As a result of our review, no significant matters were identified. And I guess this is a testament to the team for having great controls in place. And with that, I'll just take a pause if there's any questions related to technology.
Okay, well, thank you, Sandy. So now turning it to page 10, this is the areas of focus of audit emphasis. When we met with you in June, we set aside the approach, and the approach is very similar. Nothing's really changed from the significant audit areas, although from a grants perspective, there was additional funding that we said that we focused on. I'm just going to touch on 2 areas, the 2 areas of the most significant risk. If there's questions later on about any of the other areas, happy to address them. So the first is the accounts receivable, the patient accounts receivable, and the related revenue. As James and Jay explained, those balances increased, and really as a result of the case mix index, the CMI, and the risk pool receivables. So as it relates to our testing, from a revenue perspective, both at interim and year end, we do detailed revenue testing. And what that means is we take it down to the level of the medical records. So we select medical records, and we look through those medical records. We don't do confirmations, but we perform various detailed procedures relating to the patient selected. We also perform cutoff testing, and we review management's methodology. And then to ensure the reasonableness of the receivable at year end, we do a year-over-year comparison. We look at subsequent cash receipts received in 21 over 20 and compare it to receipts received in 20 over 19. And then as well as since Epic has gone live and any new systems, we perform procedures over the Epic implementation of those new sites. On the receivable side, which isn't necessarily discussed here, I'll touch on later, the grants receivable is a significant area. We spend a lot of time, and that was really divided into 2 sections this year. The normal, I would say, course of action grants that you've received, and we'll talk about that a little bit later on, as well as the COVID, the CARES Act related grants. So we spend a significant amount of time making sure that the monies received from the various grants were used in accordance to meet the criteria and the restrictions as stated in those grants, to make sure that they're proper and the dollars received were used appropriately. The next area, the estimated settlements with third-party payers, we have a specialist as part of our team. And in this area, what we do is we evaluate, we look at the estimation process that management has to support both the receivable and the liability on the books. And we look at the assumptions and reasonableness to make sure that it makes sense. And that we agree with management's assumptions, and that the liability was properly and the receivable was properly stated in the financial statements, and we ultimately agree with management. Now I'm just going to turn it over to page 13. the other areas we spend time on, but I think that these are probably the most significant areas that the committee is interested in. So Dana from our insurance side is going to take us through slide 13 on the Metro Plus side.
Great, and good morning. This is Dana Wilson, the audit partner who's working with Metro Plus, and I worked very closely with John Cuda, Jose Santiago, and Lily Pham. I'd like to thank them for being ready and having all the books and records ready for our audit, and also coordinating it virtually here with us. Our audit is a unit of the larger audit, and we do an audit here at June 30 to support this audit, but also we do a regulatory audit on a calendar year basis for the Department of Insurance as well, and we'll be doing that later in the year. Our audit is focused on the critical accounts of Metro Plus, but the two largest ones are, of course, claims payable and premiums revenue. To a lesser degree, investments because they're lower risk. But we work very closely with your team, your actuaries who are Buck, our actuaries who are in-house led by Albert Lee, and then your team. And our testing over claims payable and premium revenue, while substantive and takes quite a bit of time, went very well. And I can conclude that testing was fairly stated. So I'll turn it back over to the larger team, and it was very nice speaking with you today.
Great, thank you. So if you turn to slide 15, the required communications, the first box is the one that everyone's been waiting for, I alluded to earlier. So we plan to issue an unmodified opinion on the financial statements. On the bottom of that slide, we're not aware of any significant or alternative treatments or methods that management has used in the financial statements. We've discussed with you some of those areas of higher risk, those areas of estimate, and we agree with management's calculations and assumptions of those estimates. There were no new adopted accounting pronouncements this year, which is nice for everyone as part of the management and Grant Thornton's team. On slide 16, we talk about the assumptions and the Grant Thornton's valuation service that we used to evaluate the post-retirement plan benefits. And then at the bottom of the slide, just to let the committee know, as I mentioned before, there was no fraud or illegal acts that we are aware of as part of our audit process or any material uncertainties. If you flip to slide 17, this is something that we brought to the committee's attention last year. So as part of our audit process, one of those significant areas is the areas of grants. And as I mentioned earlier, the grants population this year is divided into two sections. One is the CARES Act funding, which we're completing our testing, and the other is, I would say, the routine grants dollars that you receive every year. Last year, we came to management. We noted one significant deficiency. So as you think about control deficiencies, there's three levels. There's a regular control deficiency, a significant deficiency, and the most severe is the material weakness. The organization does not have any material weaknesses. Last year, we had a significant deficiency in the areas of grants as it relates to the revenue recognition and following the accrual basis of accounting. We have this finding again this year. Management is working to correct this. I don't know if management wants to comment here or later on in a later meeting, but this will be noted as a significant deficiency in 2020 as well. Okay. With that,
Jay,
sorry.
I think we should talk about this. But Jay, do you want to start?
Okay.
Jay, you there? Jay, are you on mute?
Yeah, I was on mute. So I just want to talk about this issue really quickly. And this is an issue that came up last year. Doesn't pertain to lost revenues or missed opportunities. This is an accounting treatment of the receivable for grants and the calculation of that, and therefore the presentation within the financial statement. There are some issues with getting some of the receivables correct. We are working with the grants team, and there has been some changes of management that we're dealing with to correct. We expect that this year we'll be able to fix this. And again, it's considered a significant deficiency because some of the numbers can't be relied upon when we calculate the receivable. It doesn't have a material impact on the financial statement, and I just want to note that that this is a control issue, an internal control issue, and something that we are dedicated to correct.
Yeah, and I'll just say I appreciate the partnership with Grant Thornton. Tammy and team have been great, right? Part of this process is to in fact identify weaknesses, and it's our responsibility here within management to fix those, and we are going to fix it starting I think after this meeting or after the finance committee meeting, right? We're going to assemble a team and do our best here. So we look forward to working with Grant Thornton on this and getting on with correcting
So that's all the prepared remarks we had. The back of the presentation is some future GASB pronouncements. I say future, they're not next year. So as a result, I don't think we need to emphasize or speak about them right now.
So for right now, I'm gonna poll each committee member for his or her questions or comments. Dr. Pagan, do you have any questions or comments on the report?
Yeah, I mean, I just want to say thank you again for all the work that has gone into this and the time that Grant Thornton has spent with us. And I really appreciate how they have explained the process to board members, especially me. And I appreciate that. I had a quick question connected to that the efficiency pointed out. Is there a clear roadmap either from Grant Thornton or from H&H so that something that is a repeat finding, gets solved, for example, this year? I mean, I'm trying to understand what are the steps that need to be taken for a solution.
Tammy, do you want to go first? I can start. I mean, I think this will continue. We look forward to working with Grant Thornton and as part of the management letter. Seeing.
I'm sorry, I can't hear you.
Yeah. So this is something that we're going to continue to work on with Grant Thornton. They will provide us a management letter, and within that, they could spell out some recommendations for us. What we're going to start today is exactly lining out, the steps that we will take, to fix the problem. First, I think we need to have a deeper understanding of what the problem is, which I think we're pretty good there, right? It's fixable. And then we need to execute, right? And how we're going to go about, improving the accounting methods. And I think it's fair, right, for us to come back to the audit committee and present our plan, and then also present periodically, how we're progressing.
Thank you, John.
I agree. And we'll work together with the various teams.
I'm positive we will. Dr. Katz? Dr. Katz, do you have any questions or comments?
Dr. Katz, she can't hear you, too far away from the table.
No questions. Thank you.
Benny Peñamora, do you have any comments?
No questions. Thank you.
Is Frida Wang back on? Is she on?
No, she's not on, Helen.
Okay. Sally?
Yes, I just had a quick question. One about order of magnitude in terms of the amount of grants involved, if you have that.
The dollar.
Yeah, Jay, do you have that number? We can certainly provide it.
Okay.
Yeah, we have over $400 million worth of grants. What we're talking about in the deficiency is a small amount on the receivable side in the recognition of revenues. It's not that we're not recognizing revenues, we're just not recognizing in the right period.
Yes.
So I think that's an important distinction, which is why this is a control deficiency, so something that needs to be looked at. But it's, and I didn't do the testing, Grant Thornton did, but it would be, in the magnitude of less than $10 million in terms of picking up the right revenue.
Okay, thank you.
Thank you so much, Jay. Just on my behalf, I just want to thank Grant Thornton and Jay and John, all of your team for, audits are never easy, especially an audit this size. So I just want to thank you for all your hard work and for a great report. Hearing that, I would like to request a motion to accept the fiscal year 2020 financial statements. Anybody second?
Second?
Thank you. Now I'll poll each member for his or her vote. Dr. Jose Pagan,
Yes.
Dr. Katz,
Yes.
Benny Peñamora,
Yes.
Sally Pinero.
Yes.
Thank you so much. Motion is passed. Now I will call a motion to convene an executive session to discuss confidential and privileged matter that might be related to an anticipated or actual litigation, as well as certain personnel matters. Can I hear a second?
Second.
Thank you, Sally. Dr. Pagan,
Okay.
Yes.
Dr. Katz,
Yes.
Benny Peñamora,
Yes.
and Sally Pinero.
Yes.
Now, Kalisa will, I guess anyone but committee members will stay on the line. Everyone else can log off. Thank you so much.
We
Bye,
ask the
everybody.
committee members and the
Thank
general
you.
counsel to please stay on the line. Thank
Have
you
a good
very
day.
much.
Do you need the reporter again, or are we done with this record?
No, we're done with the recording. Thank you very much.
Thank you.
With the reporter. Kill you too.
Yep. 10 seconds. I have to end it.
Yeah, I just gotta take a leave.